Ranking Member Graves, for the invitation to address this committee again. As Chairwoman Velasquez referred to, this is my third appearance before this committee. I won't go into quite as much detail about what the Coca-Cola Bottles Association does and some of our own history as a result. A lot of it is laid out in my statement. What I will say is that we are in the business of serving our members in every way we can, and a particular focus of that service is on our smaller members. Our members range in size from the largest, which has 50,000 employees, down to a number of bottlers that are much like Mr. Ratner's companies. They have 50 or fewer employees. Approximately half of our remaining 73 members have less than 150 employees, so they qualify as small businesses. We serve them in every way that we can, and we're successful in almost every arena in providing the same level of service to them and getting their cost to the same level as the largest members, ranging from liability insurance to employee benefits to purchasing to any number of other areas. The one place where we cannot provide that service in the way we need to is in the healthcare arena. And I think that speaks volumes about the problems facing small business, because it alone, among all of our challenges, is the one that we need help from Washington in solving. Our small members were once part of a pool that the Bottlers Association managed, and yet in 2000, shortly before I joined the Bottlers Association, we were forced to abandon that pool because of the administrative cost associated with compliance with state mandates, state regulations, and a number of other administrative issues. And as a result of that, our members' costs went up astronomically very quickly. What happened to them is reflective, I think, of what's happening in the small business community in general, and why we have such a challenge with the uninsured is that a number of their members cut back on their policies. Many of them discontinued family coverage and offer only individual coverage. And frankly, a lot of their employees have lost their health insurance, either because they can't afford the copays, they can't afford the share that our members have to charge in order to be economically viable, or the benefits have been cut in a way that they choose not to participate because of the remaining costs. Now, why is that? Well, as I said, part of the issue is state regulation, but it's not the entire issue. I attached to my testimony a study that Mercer did for us that looks at the sources of the 18% disparity that Congressman Graves referred to. And what it shows is there are three primary drivers of that. One is higher administrative cost. The second is a significant difference in the premiums paid for shifting the risk. And the third is what I believe is some differences in terms of the effectiveness of chronic disease management by the employer. The issue, said quite simply, is that large employers are operating in a self-insured environment, have efficient plans with scale in their administration, and don't pay a profit-driving premium to carriers to take on risk because they're largely self-insured. If we were in a position to create the same kind of pooling, the same kind of scale for our smaller members, we could achieve the same savings and reduce that disparity to a significant degree, even leaving state regulation in place. So where does that leave us? Well, what that leaves us, in my view, is three basic needs that small business have in order to solve the challenge they're facing relative to providing health care. One is an uneven playing field. So we need Congress's help in making the playing field even. Second is an opportunity to do risk pooling and in the process of doing risk pooling, doing risk retention. And the third is to create a system where incentives between the employer, the employee, the people who are likely to be driving decisions as to healthcare utilization are aligned in terms of the economic interest. I believe that the bill that Congresswoman Velasquez and Congressman Graves are introducing today, the Choice Act, will achieve all of those objectives from our perspective by creating a tax credit to facilitate the formation of the cooperative pools, and by providing a sufficient tax credit to make the playing field more even. In our case, our members will be able to offer affordable health care once again. It is the only solution, frankly, that our members need. If it were enacted by Congress, we would have no reason to oppose mandates because our members would be able to provide coverage. Now, I'm not about to speak for every other small business and say that this is all they need, but in our situation, based upon the way we do business, it is all we need to restore coverage and restore affordable health care for our smaller members.